As many of you know, carcinoid heart disease occurs because of the neuroendocrine tumors produce metastases into the liver, and those liver metastases produce vasoactive substance, particularly serotonin, that produce dysfunction on the tricuspid and the pulmonary valves, leading to the right-sided heart failure. I'm Dr. Juan Cristiano. I'm one of the cardiac surgeons at the Mayo Clinic in Rochester, Minnesota. We published this article in the January issue of Mayo Clinic Proceedings. The title of the article is The Impact of Tumor Burden and Cardiac Factors on Survival After Valve Surgery for Carcinoid Heart Disease. In this article, we explore the outcomes of 168 patients with carcinoid heart disease that were operated between 2000 and 2023. We wanted to look at the outcomes after the surgery, particularly in the impact of cardiac factors and tumor factors in the long-term survival. And we explore the metastatic burden in terms of the tumor factors, particularly liver metastases, the burden of liver metastases, and we classify those patients as those who had more than 75% and those who had less than 75% of the liver replaced by liver metastases, as well as those patients who had bone metastases. And also we explore the cardiac factors, and the cardiac factors, we use two of them. One was the functional class, the NYHA functional class 3 or 4, and the presence of severe right ventricular dysfunction. The findings of the studies are as follows. The operating mortality was 6%. The long-term survival was, the median long-term survival was 2.9 years. And the factors that impact the long-term survival are both cardiac factors and tumor factors. From the tumor factors standpoint, the presence of more than 75% replacement of the liver by liver metastasis decreased the long-term survival to 2.1 years, while the presence of bone metastasis decreased the median survival to 1.7 years. At the same time, the presence of cardiac factors that impact negatively the outcomes are NYHA functional class 3 or 4 at the time of presentation, and that also reduced the median survival, as well as the presence of severe right ventricular dysfunction. What is the importance of this? Well, this study helped us to evaluate the patients before surgery and select those patients who will benefit from surgery. In our institutions, we have a multidisciplinary team that consists of cardiologists, oncologists, and surgeons, as well as anesthesiologists that evaluate these patients, and based on this type of information produced by this paper, help us to select the patients who will really benefit from surgery. We always continue to evolve in our knowledge, and particularly in the areas of carcinoid heart disease, and we are looking into other areas. We will study the impact of different tumor markers and in the outcome of the patients with carcinoid heart disease, and the use of different and novel therapies in order to impact the outcome of these patients. I would like to invite you to read the article on this issue of the Mayo Clinic Proceedings.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.